Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing a Kahoot and we're going to be covering pharmacology. Specifically, we're going to be going over drugs that you should know very well if you are taking the ATI or HESI exit. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. I've got lots of great resources there available for you. You can find me on all of the social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. Drugs to know for ATI HESI exit. First question. Mannitol is primarily indicated for urinary retention, cerebral edema, congestive heart failure, or diabetic ketoacidosis. What do you guys think? There's at least 50 people in the room. Come on. For the latecomers, the code to get in is 793-620. Can you guys type that in on the live, please? For the latecomers, 793-620. Okay. Correct answer is cerebral edema. Mannitol is one of the drugs you absolutely need to. Matter of fact, not only do you need to know it for ATI has the exit, you need to know that for NCLEX. Okay, you need to know this drug. This drug is an osmotic diuretic. Again, if you're studying for your boards or your exit, make sure you're taking notes. It's an osmotic diuretic. It's used to treat cerebral edema. And what it does, it draws the fluid from the brain back into the vessels. You need to know that. Now, let's look at the wrong answer choices. We're looking at urinary retention. For urinary retention, the patient would get something like a cholinergic agent or they'd be catheterized, not mannitol. Um, Next, CHF. You give mannitol to a patient with CHF, you're going to make that CHF worse. Did you hear what I told you the action of mannitol is? The way it decreases the cerebral edema is by taking all that fluid that's up here in the brain and put it back in the vessels. So you have all that fluid in the vessels, that's more pressure. More pressure in the vessels. The higher the blood pressure, the more workload of the heart. So you don't want to do that. And then diabetic ketoacidosis. For diabetic ketoacidosis, we are not giving mannitol. What are we giving? Insulin. Guess what? Not only mannitol, but everything else. You see these options. There's a reason I chose these options. All of these options and the explanations I gave to you of why we would not give mannitol, you need to know. Okay, so if you're playing live right now, this is going to be recorded on my YouTube channel. Make sure you go back and you take notes and you know everything I'm talking about that's coming out of my mouth. Don't say I didn't warn you. All right, which of the following is a serious adverse effect of amiodarone? Is it bradycardia, hyperglycemia, liver cirrhosis, or urticaria? What do you guys think? Bradycardia, very good. So, this drug is an antidysrhythmic agent. You need to know that. So, what happens if it works a little bit too well? You mess around and cause bradycardia. Heart rate's supposed to be between 60 and 100. It's not supposed to drop lower than 60. Other adverse effects you need to know regarding this drug, pulmonary toxicity, thyroid issues, elevated liver enzymes. Yes, it can cause elevated liver enzymes, but not liver cirrhosis. Liver cirrhosis is not directly associated with amiodarone, but elevated liver enzymes is. Okay. Dextromethorphan is used to treat constipation, productive cough, non-productive cough, or nasal congestion. You guys are all over the place on this one. The code is 793-620. 793-620. Wow. 23 of you guys went with productive cough. The correct answer is non-productive cough. So before we even get into this, let me tell you something. If you're taking the test and you have no idea what the answer is, and you see two questions that are the complete opposite, choose one of those. Take your chance and choose one of those. Okay. In this case, you have productive cough and non-productive cough. The correct answer is non-productive cough. And here's why. This drug, you need to know what it is, and it's a cough suppressant. It's a cough suppressant. So the 23 of you guys who went with productive cough, do you know what productive cough is? That means you're coughing, but you're coughing stuff up. You're coughing up mucus. You're coughing up crap that's not supposed to be there, right? So imagine you got that crap in your body that you're supposed to be coughing up because it's not supposed to be in your body, but now you're taking this cough suppressant, so it's staying in your body. Why would you want to keep crap in your body? No, you want to cough it up, right? So it's a cough suppressant, and it's going to be given for the patient that has a cough, but a non-productive cough. We're suppressing the cough because there's no crap that they need to cough up. Does that make sense? You see what I'm saying to you guys? That's how you have to remember it, okay? All right, let's keep going. A key teaching point for a patient taking methylcellulose is take on an empty stomach, limit fluid intake, mix with water, or take with milk only. What do you think? Thank you, Tara. What do you think the answer is, guys? Okay, very good. Mix with water. And not only mix with water, you're going to teach the patient to mix with water and drink right away. Okay. This is a bulk forming laxative. And so you're going to have them take it with fluid, but they're going to take it right away. It basically helps prevent like intestinal obstruction. Take on an empty stomach. You're taking it with fluid, limit fluid. No, you want lots of fluid. Guys, when it comes to constipation, fluid, ambulation, fiber, those three things are your best friend. So you're going to take lots of fluid and take with milk only. What is a one word in that phrase that made you know that could not be the answer? What did I teach you? When you see this one word, skip it. What's that word? Take with milk only. That's right. We stay away from all inclusives. The minute you saw only, you should have said, nope, that can't be the answer. Okay, so make sure you know this drug. Make sure that you know it's a bulk forming laxative. Make sure you know the nursing interventions when giving this medication. Glipizide is indicated for hypoglycemia, hyperglycemia, diabetes mellitus type 1, diabetes mellitus type 2. What do you think? What is your answer? You guys are doing great on the live. So let me make this question a little bit more complex. What's a drug class? Because you need to know that. Not so much for the exit, but if you're taking pharmacology, that may be a question on your exam. What is a drug class? I'm still waiting. All right. Very good. Diabetes mellitus type 2. So let's talk about this. Glipizide is a sulfonylurea. Let me tell you something about this drug class. By the way, this is an anti-diabetic agent. So let me tell you how it works. The sulfonylureas literally walk up to the pancreas and says, knock, 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 wake up, pancreas. Wake up, beta cells in the islets of Langerhans, which is part of the pancreas. I need you to wake up because I need you to shoot out more insulin because the glucose is too high. Guess what? Patients who are type 1 diabetics, that sulfonylurea will be knocking all day. That thing will never work. That patient will be 6 feet. Is that how what we bury people 6 feet under or 12 feet under? Whatever. They're going to be in the ground. Why? Because the patients who are type 1 diabetics, pancreas isn't working. There's no function. The patients who are type 2 diabetics, now the pancreas may not be working to the point that it should be, but it's giving something, right? So the type 2 diabetics, they're the ones who can get the sulfonylurea and they'll stimulate the beta cells in the islets of Langerhans of the pancreas to shoot out more insulin. You got that? Okay. What is a serious potential adverse effect of Epoetin alpha? Is it neutropenia, hypertension, hyperkalemia, or tachycardia? That's right. If a patient is type 1, that's all they can get, insulin. They can't get any oral anti-diabetic agents. They have to get insulin. Very good. So many of you guys on the live, I saw all of you guys saying red, 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 red. What made you guys, just out of curiosity, what made you guys go with neutropenia? I just want to know where the confusion is so that way I can, teach better. What made you guys go with neutropenia? Okay, while I'm waiting for you guys to answer, the correct answer is hypertension. So let's talk about this. This drug, you have to know it, Epoetin alpha, is basically an erythropoiesis stimulant, right? So what it does, it makes the bone marrow, because the bone marrow, that's what's responsible for your blood cells, your WBCs, your RBCs, your platelets. It makes the stimulates the bone marrow to make more RBCs. Why is RBC important? Well, RBCs have hemoglobin. Hemoglobin is what carries oxygen to go to your tissue. So, yeah, that's important. However, you need to think about it. All of these RBCs, hematocrits increased, blood viscosity increased. What do you think is going to happen to the blood pressure? Hypertension. So, we're going to be very careful about that. We're going to be watching that. We're going to be taking that patient's vitals, right? Those people with full confidence said red. Everyone on the live said red. But make sure you guys know this drug. And when you see this drug, I want you to think of RBCs, okay? It stimulates the production of RBCs. Cyclobenzaprine is used to reduce seizure frequency, treat spasticity and cerebral palsy, relieve muscle spasms, or reduce tremors in Parkinson's disease. What do you think? Okay, you guys are back on track. The code to get in is 793-620. 793-620. Okay, so the correct answer is relieve muscle spasms. So this drug, guys, is a muscle relaxant. It's used for acute musculoskeletal injuries like sprains, on strains, things like that. It's a muscle relaxant, relaxes the muscles. Okay, now Let's look at the other options. All right, the first one, reducing seizure frequency. That would be what? An anti-epileptic agent. You need to know those, by the way. Okay. And that would be an anti-epileptic agent. Next, treat spasticity in cerebral palsy. That would be like an antispasmodic agent, something like baclofen. You need to know that drug. And last, reduce tremors in Parkinson's disease. What would that? Those would be anti-Parkinsonian agents. You definitely need to know that. Okay. A patient receiving mafenide acetate for burn treatment should be monitored for hyperkalemia, metabolic acidosis, Stevens-Johnson syndrome, or respiratory depression. Correct, levodopa. A patient receiving mafenide acetate for burn treatment should be monitored for hyperkalemia, metabolic acidosis, Stevens-Johnson syndrome, or respiratory depression. Wow. Okay. The correct answer is metabolic acidosis. And I knew this question was going to trip you up, but I'm going to teach you guys something so you never make this mistake again. Okay? So before, no, let's talk about this medication first. I'll tell you why metabolic acidosis, and then I'll talk to you about the trick, not to be tricked. Okay? So this drug, it stops carbonic angi I can't pronounce it, carbonic anhydrase, right? And so that increases the acidity of the blood. And that's what causes the patient to go into metabolic acidosis. Okay. This drug is a topical antibiotic agent, but it can cause metabolic acidosis. Um, Now, here's a trick. Look at the question. It says a patient receiving mafenide acetate. So I gave you the drug for burn treatment and I gave you the disorder or the problem. Here's where a lot of you guys go wrong. Whenever you get a test question and they tell you the patient's diagnosis, here is the patient's diagnosis of burn, right? Burn injury, and they give you a drug, you focus on the diagnosis instead of the drug. Guess what? Whatever that diagnosis is, the patient's already got it. That's not going to change unless they get a drug or treatment. What's going to change in their body? That drug or treatment. So whenever you see a question that has a drug and a diagnosis, unless the question is specifically asking you about that diagnosis, focus on the drug. See, you see this question? If you're focusing on the burn, then yeah, you'd be thinking hyperkalemia because as a student, you're going to say to yourself, okay, burns in the initial phase, yeah, that patient will be hyperkalemic. And then as that burn starts to resolve and the patient's getting fluid resuscitation, they start getting better, then they can be hypokalemic. But you're thinking about burns. If you chose Stevens Johnson syndrome, by the way, you need to know Stevens Johnson syndrome as well. It's very lethal, it's very deadly, it's a skin disorder. But still, you chose that. You still think about the skin, you're thinking about burns. If you chose respiratory depression, you're saying to yourself, okay, when it comes to severe burns, that patient could have inhalation, right? The smoke that you're breathing in from the burn, and it causes your lungs and your throat to close up, your airway closes up, which actually absolutely does happen. It can happen. But again, you're focusing on the burns. If you focused on that medication, the only answer here would have been metabolic acidosis. And lots of test questions trick you that way. So whenever you see a test question with a diagnosis and a medication, again, focus on that medication. That diagnosis is really a deterrent. It's just to throw you off, okay? You guys with me? All right, let's keep going. True or false? A serious potential adverse effect of amphotericin B is hyperglycemia. Is this true or is this false? Thank you, my followers from the Philippines. Thank you for watching. False. Only 18 of you guys went with false. Okay, let's talk about wording. The question asked about a potential adverse effect of amphotericin B. Serious adverse effect. First of all, hyperglycemia is not a serious adverse effect. Let's just get that out the way. But let's talk about this hyperglycemia. What kills you faster? If you had to choose a serious adverse effect, hyperglycemia and hypoglycemia, what kills you faster? Hypoglycemia. That's number one. That's number one. You have hyperglycemia. You got time, baby. You got hyperglycemia. You start getting polyuria. You're urinating all over the place trying to get rid of all that glucose. You have polydipsia. You're thirsty. You're drinking all this water trying to dilute all that sugar. You got polyphagia because your cells are dying because they need the energy, right? So you're hungry. You're trying to eat food to get that glucose um in the tissues where they belong instead of the bloodstream. We talk about potential adverse effect and hyperglycemia is what you want to go with. No, it is not. So let's get that out the way. Number two, amphotericin B. What is it? This is an antifungal agent, and it's only used for severe fungal infections. Why? The adverse effects are so horrible. The adverse effects of amphotericin B, which you have to know for testing purposes, are so bad. What do they include? Kidney damage, like literally, it'll make your kidneys shut down, right? Kidney damage. Severe anemia because it will cause your body stop making RBCs or definitely not enough RBCs. So severe anemia. Anaphylaxis, you could go into anaphylactic shock. Neurotoxicity, you can have seizures, confusion, lethargy, just messes with your brain. So that's why we do not give amphotericin B unless the patient has a severe fungal infection. Like we have no other option. Like, okay, we're going to throw this at them or they're going to anyway, right? That's the situation. So when we talk about potential adverse effect, you need to be thinking bad, 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 not no hyperglycemia. Come on. Okay. Make sure you guys know amphotericin B. Make sure you know the drug class. Make sure you know the adverse effects and make sure you know the nursing interventions for it. Okay. Guys, don't worry. Everything I'm talking about now, it will be posted on YouTube. It's going to be posted on YouTube. I feel like there was something else I want to tell you about the slide, but I can't remember what it was. It'll come to me. Next. True or false? Filgrastim is given to patients with thrombocytopenia. Is this true or is this false? And I do remember what I wanted to say to you guys. Please, guys, I come on here, I do these Kahoots for you. I don't ask for a penny. I don't ask for donations. I don't ask for anything. But I'm going to ask you guys something today. If you have not done so already, please go on my page, watch my video. You'll see a picture of my son. He's running for Athlete of the Year. Click on the link and give him a vote. If you appreciate what I'm doing for you, you want to show some appreciation back to me, that's the one thing I ask you. Vote for my baby, okay? Vote for Matthew, please. Thank you. All right. Filgrastim is given to patients with thrombocytopenia. False. Do you remember a couple slides ago when we were talking about Epoetin alfa and you had the choices and everybody and their mama was going with increased neutrophils and the correct answer was to, it increases RBCs? Well, guess what this drug does? This is the drug that increases neutrophils. This is a drug that we give to those patients who are getting chemotherapy, they're getting radiation, and now they have neutropenia because of, the radiation or the chemo treatment. This is a drug, filgrastim. So when you see filgrastim, I want you to think of stimulation of neutrophils. And when you think of Epoetin alfa, I want you to think of stimulation of RBCs, okay? Where can we see where we will vote? There's a link. Don't do it now because I want you to finish this Kahoot. But afterwards, if you're on TikTok, you're on Instagram, Facebook, YouTube, it's on my page. Just go there. You'll see his picture and you'll see I put the link. Just click on it to give him a vote. Real easy. Okay, which is important patient teaching for fluoxetine? The effects are immediate, discontinue when symptoms improve, may take 4 to 6 weeks to full achieve therapeutic effects, causes weight loss in all patients. Okay, you guys all know this drug. Very good. 5 more minutes. All right. May take 4 to 6 weeks to achieve full therapeutic effect. You need to know this drug. This is an SSRI. The drug, SSRIs are antidepressant agents. SSRIs are the first line treatment as far as drugs are concerned when it comes to antidepressants. Why? They're the most effective with the least amount of side effects and adverse effects. So it has less side effects and adverse effects than your TCAs, your MAOIs. So you expect the SSRIs to be ordered first before any other class of antidepressant agents. However, there's still some important things that you need to know about those SSRIs. You need to know that it takes 4 to 6 weeks before the patient will start to feel the effects. You have to tell them that because if they're already depressed, and you don't warn them and they're taking the SSRI after a couple of days, they're going to say, what's wrong with me? Everybody else takes an SSRI and they get better, but I'm still feeling down in the dumps. I knew it. I'm a loser. And they're going to feel even worse and stop taking their drugs. Stop taking that drug, excuse me, that medication. So you have to warn them. That's number one. And number two, another important thing you have to know about SSRIs, they have a black box warning. Don't even play. Let me tell you something. SSRIs will cause I can't say that word on TikTok, but when you want to yourself, right? It causes those thoughts in children, in teenagers, and young adults up to 24 years of age, especially during the first few weeks. So initially, when the patient's getting that treatment, it can cause those thoughts. And children and young adolescents, they can't think far into the future, so they're more likely to try to follow through on those thoughts. So you need to know that, and you better be watching them like a hawk. Don't even play. I'm telling you. Make sure you know the SSRIs. All right, one more. Pilocarpine is indicated in the treatment of asthma, glaucoma, hypertension, or cataracts. What do you think? Last question. I saw someone just said they voted. Thank you. I didn't catch your name, but thank you. If you guys see me, I keep looking off to the side. I gotta take my son to training, and I went a little bit over time. All right, so the correct answer is glaucoma. Very good. This drug, you need to know that it's a cholinergic agent. And so what it does is it decreases ocular pressure. Something else you need to know what's the normal pressure. It's 10 to 21. Higher than 21, glaucoma. You're thinking glaucoma, okay? It treats open angle glaucoma. So you need to know that it treats open angle glaucoma. It decreases ocular pressure, and it's a what? Cholinergic agent. Okay, so that is it. If you guys want to, because there's way more drugs that you guys need to know for that exit exam. But if you guys want me to do a part two, part three, this video is going to be up on YouTube in a few hours because I got to get going. But I'll come back, post it on YouTube, and just in the comment section, just let me know if you want to see more parts. I definitely can make several parts for you and let you know the important drugs that you need to know for your exit exam. And with that being said, please do not forget to go and vote for Matthew for Athlete of the Year. The link is on my page across my social media platforms. Thank you so much for watching. Let's see how you guys did.